Carotid ultrasound is a very common exam in our radiology department. In this video, I'm going to show you how to perform a carotid scan. Patient lie in supine position with neck overextended if possible. Several transducer positions can be used to examine the carotid arteries depending on the location and the course of the vessel. This picture shows some common probe positions including anterior, lateral, posterolateral, far posterolateral, and transverse positions. The common carotid artery should be checked from its origin to the bifurcation for any intimal thickening and color field. Spectral Doppler is measured at proximal, mid, and distal portion. When you look at the waveform, common carotid artery has a relatively low resistance pattern. To demonstrate the bifurcation together with proximal external carotid artery and internal carotid artery bulb, the probe position varies through individuals. Generally speaking, posterolateral position is most useful, however in some tricky cases, anterior or lateral position work best. Again, the B mode and color images of bifurcation should be obtained to look for any possible plaque. Walk the cursor through entire course of carotid artery in transverse plane, especially the bifurcation is very important. This offers better assessment of intimal thickening, plaque extent, and lumen narrowing. From the bifurcation, the external carotid artery usually sits more anteriorly and medially. Track the vessel as far as you can. The external carotid artery has a high resistance waveform. The flow velocity rises and drops quickly in both systole and diastole period, giving a sharp systolic peak appearance. Another way to confirm external carotid artery is by tapping at the level of zygoma arch just anterior to the external ear. Fluctuation of the diastolic waveform is called temporal tap. The position of internal carotid artery is usually more lateral and posterior in the neck. Be mindful that in some cases, the internal carotid artery may be very short due to high bifurcation or very tortuous before entering the skull. The waveform of internal carotid artery has a low resistance pattern with a gradual tapering of continuously forward flow throughout diastole. Therefore, the systolic peak is more blunted compared to the sharp one in external carotid artery. To locate the vertebral artery, find the mid to distal portion of common carotid artery first with color, then pan the probe slowly to the lateral aspect. The artery is the one hiding between the vertebral transverse processes. Relatively low resistance and flow velocity are the features of vertebral artery waveform. And the color of vertebral artery should be the same as that of common carotid artery, otherwise subclavian steal syndrome should be suspected. That's the end of the video. Thank you for watching.